Hi there, we are Group 1 and we are addressing medical care in rural Canada, specifically in providing accessible healthcare to rural and Indigenous communities. My name is Greg Metcalf.
And I'm Emily Betts.
Our main topic was derived from a How Might We activity. It is how might we increase the access of information and medical services to rural and Indigenous areas, with a subtopic of how might we ensure that Indigenous people are treated equally, no bias, in the presence of medical professionals.
Defining the opportunity space. We decided to focus on people aged 18 to 35 with specific attention paid towards women because women tend to have a higher chance of being dismissed by doctors and are also typically responsible for the medical care of other people in their families, like children, parents, and grandparents. These are our personas based on our target users. Carol Smith is a 35-year-old woman in rural Ontario with one child and a dog. Carol wants to find a doctor who takes her seriously. Monica Campbell is an 18-year-old Indigenous woman living in a multi-generational home. She is looking for a doctor who will respect her culture and her mental health. There is a significant problem with the current treatment of people in rural areas. They have a higher chance of dying from treatable and preventable causes. They have fewer doctors and even fewer specialists, along with cultural problems that arise when living in isolated communities. There are a lot of opportunities that could be brought to this area, like developing technology for long distance doctor's appointments, educating communities on medical information, and including all insurance plans.
Justifying the opportunity space. The size of the opportunity space was determined through secondary research. This idea could reach 144 municipalities, 106 First Nations, and over 150 other unincorporated communities. 26% of Ontarians live in rural areas or small population centres. 32% of Indigenous people in Ontario live in these rural areas. And additionally, mobile health applications rose a staggering 65% since the beginning of the pandemic. Our last point is more of an insight that shows us that the space is relatively new and only a few strong solutions exist. Even then, they aren't perfect. So, how painful are the pain points? Remotely connected doctors are not connected with their peers in person. They may differ in how medications are prescribed. Some of the physical, social, and cultural barriers are the distance to travel, road conditions, access to transportation, shaming around obtaining healthcare, and a lack of financing, and doctors don't want to work in the remote areas. Some market trends we gathered is that the mobile health application industry was valued at nearly $25 billion in 2020. This has grown 65% since the previous year due to the pandemic. It is estimated that the market will reach nearly $40 billion by 2021 and over $300 billion by the end of the decade. Some of the competitors that we got to look at were Sanvelo, Maple, Tia Health, and See the Doctor, aka the Ontario Virtual Care Clinic. Sanvelo is a web and app-based service that operates 24/7 to connect users with therapists, and Sanvelo currently has 3 million users worldwide. Some of the cons about this is that it's geared only towards mental health and it's a subscription-based service. Tia Health is a web and app-based service again that operates 24/7 and connects users to doctors. However, Tia Health is only covered by OHIP. It doesn't have an app, there's no intuitive user experience, and the website can be overwhelming. So some of the common themes we've noticed among our competitors is that OHIP coverage is necessary to cover a large percentage of Ontarians, and more than just connecting a patient to a doctor, that some of them are information overload, and that these services are lacking a strong narrative to guide the user along a UX process. And some of the barriers to entry is a lack of access to technology in these rural areas and Indigenous communities. The majority of healthcare services require private insurance or OHIP coverage, and some mobile health apps have implemented subscription services. And lastly, there is unstable infrastructure such as internet. So is this a moonshot idea or an incremental innovation? It is something that will take planting a seed to form the foundation of trust within Indigenous communities. To entrust the proposed solution, start by incorporating translators and other Canadian languages into the solution. Start in one community and work your way outwards. Create a positive impact with alpha testing and promoting transparency towards the solution with medical professionals and community leaders.
Potential solutions. We are looking into creating an app that allows typically isolated doctors and patients in rural Ontario to connect with doctors, physicians, and specialists outside of the communities to provide standardized, inclusive healthcare testing. We would reach out to community leaders and users to conduct interviews about their needs, wants, and frustrations, and complete extensive user testing. Thank you for your time, and please reach out to one of us if you have any questions.